It's time for Cadlick on Call on 610 KONA. It's your opportunity to call in and get your health questions answered. Call 547-1610. That's 547-1610. Now, here's Jim Hall.
And a very pleasant good evening, good Wednesday evening, everyone. Welcome to another edition of Cadlick on Call. Each Wednesday evening from 6 to 7 at this time, we come your way and talk about particular health or medical topic of interest to our listeners here in the greater Tri-Cities and Columbia Basin region. And in the spirit of really the start of school this September time of year, we thought we would continue that theme. And tonight we have a really neat opportunity to talk about a very unique type of healthcare that is provided just up the road from Pasco near Mesa. And it is called Hippotherapy and Adaptive Riding, where horses are used to help patients recover, and all kinds of patients of all ages and all sizes, and suffering and dealing with a whole myriad of types of health-related issues. And so tonight, we have some experts in this field with us in the studio, and we want to share a little bit about it with you because it's really a fascinating topic and really speaks to the, I guess, uniqueness of the kinds of healthcare that can be provided here in our community. And so we have with us live in the studio Keely Bowen and Megan Marston. They are physical therapists at Cadlick Regional Medical Center. Also, Jill McCary is with Strides Therapeutic Horsemanship Center, which is located up in Mesa, and she is the one who trains the horses that provide not only hippotherapy, but what she uses in what is called adaptive riding. And so all kinds of patients take advantage of this. And we also have Shondine Schwindeman, whose sons... It was originally one son, but now she tells me two sons who are doing adaptive riding with Jill. So a lot of interesting stuff to cover in our short time tonight. So let's get right to it. I want to start first talking about hippotherapy, and let's welcome Keely and Megan, first of all, the physical therapists who work with patients. Okay, the question I always get when I bring up hippotherapy is how in the heck did it get its name when it's horse therapy that we're talking about? Anyway, explain for our listeners, what is hippotherapy?
So hippotherapy comes from the Greeks, the hippo meaning horse, and it goes all the way back to Socrates. And so hippotherapy is one of many treatment strategies that physical therapists, occupational or speech therapists can use to help treat their patients and get them better towards their functional goals.
So, and that was Keely, who is one of the physical therapists who are doing hippotherapy and working with patients. Megan Marston is the other. And Megan, maybe give us a little bit of a overview quickly of the types of patients that you and Keely work with on a regular basis.
We see all sorts of different patients out there. I see kids with all different types of conditions, autism, developmental delay, recovering from injuries. We can treat patients with spinal cord injuries or spinal bifida out on the horses. And then Keely also sees adult patients as well. So she does adults and kids, and I do kids alone. And just almost any type of problem that comes into the clinic, we can look at for taking out to use the horses for their treatment.
Now, gosh, I have all these questions. I got to try and keep this so it flows nice and smoothly. But the training that went into this, you obviously had to get certified, right, to provide hippotherapy?
So both Keely and I have taken the American Hippotherapy Association Level 1 and Level 2 training classes, and we're currently studying to become certified therapists. So we're physical therapists that provide hippotherapy as a treatment strategy.
Okay, and before I bring Jill to the microphone, I have one more question that I wanted to ask you is, how do you determine then, is it during a normal assessment when a patient comes into your clinic to say, hippotherapy would be great for this patient?
Yes, so to be able to participate with the hippotherapy, patients come in for just a typical physical therapy evaluation. They can also do occupational therapy or speech therapy. And so you come into the clinic for your initial evaluation, and then through that, we can look at what problems are going on with the patient and decide if that's the best treatment option for them.
Very good. And now we want to bring Jill McCary, who's with Strides Therapeutic Horsemanship Center, and it's located up in the Mesa area. And you're the one who basically brought hippotherapy and what you call adaptive riding to the patients and people here in our community, in our region. Explain, I guess, first of all, what is adaptive riding, Jill?
Well, adaptive riding is teaching riding skills to those that have either physical, emotional, mental problems or disabilities, and we teach them actual riding goals. So it complements with the hippotherapy in that we are still using the horse and still setting goals for those. If they're students in the school district, we tend to like to help with IEP goals or 504 plan goals so that we're giving them real life experience and the horses are able to let their brains actually function and think through the things that we're asking them to do, because we ask them to do some pretty hard things.
Now, how did the idea, and I guess originally when you started your operation back in 2006, was that correct?
2006, yes.
And with the adaptive riding, and then now you decided you've added the hippotherapy to it as well in the last year or so. I guess talk a little bit about that.
Well, Strides was actually started by Jennifer Casey, who is a physical therapist. At that point, she was a physical therapist for the North Franklin School District. And Sean Dean's little boy was coming into the school district, and I was going to be working with him. And so Jennifer had seen how working with horses had helped when she was in her physical therapy program, when she was studying, the difference that made in the patients that she had seen doing that. And so it was her idea to start this with one horse, which was Jennifer's horse, and Braxton. And it kind of took off from there. And we now currently are serving, along with the hippotherapy, we serve about 63 clients a week. We have 10 horses in our program now. Wow. We range from 35 to 45 very, very dedicated volunteers, and we average about 135 volunteer hours per week. So it's gone from very small to quite a bit bigger. And in with that, we've thought that adding the hippotherapy would just be another avenue for Strides to be able to serve those that are in need.
Very cool. And Shondine Schwindeman, whose son has been working with Jill for these past several years, share a little bit about your impressions of how this has helped your son and what it means to you to have this service available here in our community, in our region.
When Braxton first started, he had very little speech, a lot of PT goals, OT goals, and when we started, he would not even touch the horse. I think we walked around the arena next to him.
And how old was he when he started?
4.
4 years old.
4 years old. And he's 14 now. And it's just progressed that we've worked on speech goals. He's had eating goals. He's selective in his eating. We've done a myriad of different therapies. They've worked with him. Currently, he is an independent rider. He actually helps lead horses for other clients now in the adaptive riding program. And because of his autism, he doesn't participate in any sports, so this is the one thing he enjoys, and I think it's something that gives him a sense of accomplishment. And
you mentioned about the speech piece, is it a case of him directing the horse and communicating to the horse and learning the communication through that?
Yes, it started that way at first. When it started, it was a Blues Clues radio that when he pushed it and it stopped, he would say whoa or walk on.
Really?
Through this Blues Clues radio. And it's just all the little pieces that we've used, that Jill's used, Jennifer through the years, has increased his speech, that he's in a regular classroom at school. And
is Keely, are you working with the kids, or is Megan working mostly with the kids?
Both of us,
do?
Yeah.
And I'm guessing you've already you've been doing this about a year now, the hippotherapy. You're these stories that Shondine is sharing. you're having those same kinds of results?
Yeah, and I actually did hippotherapy at other clinics during grad school, kind of like Jennifer did. But yeah, we're hearing a lot of the same, or seeing a lot of the same things. We do pre and post testing before they get on the horse and after they get on the horse. And one of my particular clients, when she gets off the horse, we ask her to do one of two things. One of them is run, or she can't exactly run yet, so walk as fast as she can. And there's probably a 2-second time improvement when she gets off the horse. And then the other huge improvement is that before the horse, she can't jump at all. Can't jump vertical or horizontal. After the horse, she can jump horizontal about 6 inches. And this is just, and she's 3 years old. So these are typical things that a 3-year-old should be able to do. As far as Megan, she's got a really great story about another little one with feeding. If you want to hear that story.
Well, we're gonna tease our listeners and do that after the commercial break. We're visiting with Keely Bowen and Megan Marston. They're physical therapists at Cadlick Regional Medical Center, and they are providing hippotherapy to patients at Strides Therapeutic Horsemanship Center. And really a fascinating discussion. We have a lot more to learn about it, and we will do so when we return. You're listening to Cadlick on Call.
You're listening to Cadlick on Call on 610 KONA. This program provides general information only. Any comments or information presented are strictly for educational purposes. Cadlick and 610 KONA do not endorse any of the suggestions made by the presenter or callers. Now back to Cadlick on Call. Once again, Jim Hall.
And welcome back to Cadlick on Call. We're talking about hippotherapy and adaptive riding involving horses for all kinds of folks in our region here in the Tri-Cities area and the surrounding region up north and south. And the hippotherapy has really been a lot of fun to talk about this first quarter hour because there's a lot to learn about it, and adaptive riding as well. It's all happening at Strides Therapeutic Horsemanship Center, which is located up in the Mesa area. If you'd like to learn more information about it, probably the best way is to go on Facebook and just type in Strides THC, and there'll be plenty of information to learn more about it. And we have Keely Bowen and Megan Marston, who are physical therapists at Cadlick Regional Medical Center. And for about the last year, they have been providing hippotherapy out at Strides. And Jill McCary is it's her operation out there that has horses, and she has been providing adaptive riding. And we have also been visiting with Shondine Schwindeman, whose son has autism and has really seen some incredible, milestones in his life, which is really impressive to hear and very neat to hear. And Jill, I want to get back and talk about, obviously the stars of this show, I'm guessing, are the horses. And what does it take, first of all, to become either for adaptive riding purposes or for hippotherapy, a horse that would be suitable for this type of work?
I think one of the biggest things is the right attitude, the right temperament. A lot of horses come through that people have said, "Oh, I've got this great horse. It's done this, it's done that. My grandkids have ridden. We've had no problem with it." When we go through our evaluation, we find out that maybe they don't like plastic bags. Maybe they don't handle somebody that isn't secure, that may be flopping around. Believe it or not, we have had kids get on and scream and kick for 20 minutes. So you have to have a horse that is able to handle that. And there's stress that comes along with that. And so the horses get stressed just like people do.
Sure.
One of the most important things for a horse in the hippotherapy program is the way they move. So the way they track, they need to be able to track up, which basically means get their hind end underneath them so that they give some input to the rider.
Input, what do you mean?
Well, I think Keely could probably actually answer the input question a little bit better than I could, so I'm going to defer to her.
All right, Keely, you're on input.
Okay, so the input, can I go back just a slight bit?
Please do.
Okay, so the horse's pelvis is pretty much identical to the human pelvis. When the horse goes on all fours, which is how we always see them, unless they rear up, their the way they move is perpendicular to how a person moves. So if we want it to track up, and say a horse tracks up very well, it's going to give a lot more pelvic movement to the person. So say if when you're walking, your hips don't sway very well, if you're very tight in the pelvis, and we want to improve that because you need that rotation to walk properly, then we're going to put that person on a horse that can really track up and push that person's pelvis forward. And then when they take the next step, they're going to push the other side of the pelvis forward. The horse, if you need someone with cerebral palsy whose back is very tight from, say, scoliosis, we're going to put them on a horse that has more of like a quote-unquote hip drop, and their pelvis is going to drop down, which will stretch out that person's back on the one side, and so on. So that's kind of what Jill's getting towards, but they have to be able to track up to some point to maintain that rhythm, and the power has to come from the back end to give that rhythm and good movement, quality movement.
And Jill, I'm guessing you identify your horses to the patients, like, okay, well, if maybe Keely's describing we need some to do this, work with this physical part of the body, then say, that's for this particular horse would be good. Is that kind of how you match them up?
That's true, but I let Keely and Megan, since that is their forte, they actually have come out and looked at all of the horses on our, in our program, and have actually ridden them, videoed them as they're walking and trotting to get an idea of the movement. So they actually let me know which horse and which client are matched up together. So they luckily take that. They take that, and they just let me know what's going to work best for that particular client.
So you have the strengths all identified for each of the horses.
Yes.
Interesting. Okay, we talked about how the horses are trained. Now, how do you and Keely and Megan talk about the training that went into becoming skilled in providing hippotherapy?
Well, we go through, obviously, all of our education to become licensed therapists. So most of what we've learned through grad school, we carry over into the hippotherapy. It's just learning more about the horse and how that horse's movement translates to our person and how to utilize that to help get what we need out of the patient. And so, as Megan had mentioned earlier, we went through 2 very long courses. They were 4 or 5 days long each. And then there's extensive studying to go in after that and hands-on practice in before we can test for our certification. But it's a lot of hours and a lot of actual practice. You have to have so many hours before you can actually even test. So, yeah, there's a lot of work.
And where did you get this training? There's
courses all around the nation. We specifically went up to Redmond where they were offering it. So, yeah.
Okay, I have to ask both of you, you must have an interest in horses.
I have been horse obsessed since I was born. In physical therapy school, I actually did a internship down in Kentucky, of all places. It's perfect. And did hippotherapy down there as a grad student. And then I've practiced in Spokane as well. And then Megan can talk about how she got into it. I kind of dragged her into it, and she was terrified of horses, but she's not anymore. She's good now.
Okay, do tell, Megan.
So in grad school, I had a little bit of experience with hippotherapy. I spent a couple of days out with some therapists, but in that program, they only use Shetland ponies, so nice and small. It was great. And then Keely asked me if I wanted to help to join her in doing the hippotherapy when she kind of started researching everything and getting everything organized. And I said, sure, why not? It sounds like so much fun. And so a week before we went to our first training class, I said, Keely, I probably should get on a horse before we go. And so a week before we went out for our first training class was the very first time I ever rode a horse. And now I'm addicted and I'm taking lessons with Jill and love it.
Well, I was going to say, I bet maybe that helped your instruction just because of the fact, maybe some of the patients you're working with had never been on a horse either.
Yep. A lot of our patients have never been on horses. So kind of I've got that, okay.
You've got that shared fear initially.
Yes.
But you sound like you really enjoy it. Are you finding the progress your patients make? I know any kind of healthcare worker that I encounter in my line of work, it's, everybody is in it for the calling of helping others. And I'm guessing it's no different than what you guys are doing.
Yes, it's so much fun. And it's great to see the kids and the adults even getting on the horses for the first time or as they progress through their sessions to see how much progress they make each time. Before
we go to our next break, I should say we need to probably, for people that might listening, think then that they may know of a family member that might benefit from hippotherapy. What do they need to do relative to getting connected with the two of you in Strides? To come out for hippotherapy, what people need to do is contact their doctors to get a referral to physical therapy, just to come in for an evaluation. The referral just needs to be for physical therapy and whatever diagnosis for the problem that they have going on, not specifically for hippotherapy. That's just a treatment modality. So basically do the evaluation first of all, and then that evaluation will determine whether hippotherapy is the therapy for that particular patient. Yes, exactly. Awesome. And that number to call, I think, is at the Cadlick Healthplex. Keely and Megan work at the outpatient physical, speech, and occupational therapy unit at the Cadlick Healthplex, which is over on Lee Boulevard. The number to call if you have questions about that is 942-2660, 942-2660. Did you have something before we go to the break, Keely?
Yeah, just to add, when you call in and say you have your referral and you're ready to schedule, make sure you say, it's for PT, but I want to do hippotherapy, and that way the scheduler knows to put it with Megan or I. Okay, interesting. Dennis, are we close to going to another break? We got one more minute. Okay, so before we do that, there's some more of this I want to talk about, and I want to bring Sean Dean back in the next segment to hear a little bit more from a mom's perspective for someone who is benefiting the family is from this type of care. But Keely and Megan, talk to me a little bit about how frequently do you see a patient? I mean, what is a normal, do they come weekly for a period of 4 to 6 weeks, or does it vary? Currently, we see our patients for hippotherapy one time a week. Mm-hmm. We currently do it on Mondays, and it's one time a week for 8 weeks. And then we take a break and let another group of people come through for 8 weeks. And that way we can see the previous people back in the clinic and do our retesting to see how much improvement they made. I see. So they would do the hippotherapy and then return back to more clinical treatment for a follow-up. We're talking about hippotherapy and adaptive riding. We have to take our bottom of the hour break, but we will return with more of Cadlick on Call in just a minute.
Listening to Cadlick on Call on 610 KONA. This program is not a substitute for direct consultation with your own healthcare provider. Always consult your healthcare provider for your specific condition, especially if you have or suspect you may have a medical problem. Now back to Cadlick on Call. Here again, Jim Hall.
And before we return our conversation to hippotherapy, a couple of events happening that wanted to bring you news about. Tomorrow at 11 o'clock over at Cadlick Regional Medical Center, you've been noticing the construction that's happening, the large tower crane that is right above the River Pavilion. Well, tomorrow at 11 o'clock, there will be a milestone into the construction as the final piece of steel will be lifted into place by that large crane, signifying that the construction project has reached its apex, that the 10 stories is getting ready to go inside now and do all the internal work that will produce 92 additional patient rooms at Cadlick. And it's a traditional construction ceremony that's happening. They call it a topping out ceremony. And so that will happen tomorrow on the Cadlick campus as that final beam will be lifted into place. And kind of a fun little anecdote is staff members, caregivers at Cadlick, as well as patients and visitors, have had the opportunity to sign that beam. So they will be permanently a part of that historical construction project. That's happening tomorrow. And interestingly, it's coming up in a couple of weeks if you're interested. On Thursday night, October 1st, over at the Convention Center in Kennewick. Catholic has done this the last several years, has brought national healthcare leaders in to talk about, in essence, the state of healthcare and really whether it's mostly relating to policy and where healthcare is headed. And on Thursday, October 1st, Dr. Rod Hochman, who is the president and CEO of Providence Health and Services, and that is the recently affiliated organization that Catholic is now a part of. Dr. Hochman will be here to speak. It's a free talk on October 1st over at the Convention Center, so the public is invited to come and listen to it. And if you're interested in healthcare policy and maybe where healthcare is headed into the future, you might want to put that on your calendar again. That's October 1st at 7 o'clock over at the Convention Center. Now back to the topic of the night for us, and that is the subject of hippotherapy that is taking place actually out in the Mesa area, but Catholic Regional Medical Center physical therapists Keely Bowen and Megan Marston are providing that care to patients that they work with over in the Therapy Services Center at the Healthplex in Richland. But as you've heard, if you happen to hear the first part of our program, they're very passionate about learning this hippotherapy and how it's helping their patients. And I want to get back, Megan and Keely, to talk about, we've touched on the first part of our program, a lot of the children that you've been working with, but you were telling me also that you work with many adults. I guess share with our listeners the types of patients that we're talking about.
So I'm Keely. I see the adults out there. I currently have a couple patients that have spinal cord injuries. They're lower around the lumbar region of the spine. So they can walk very, very short distances with a walker, but that's not a necessity that they have to be able to do that. One lady has MS. She's probably in her 50, 60 years old. She cannot walk. She's wheelchair bound, but she's actually gained a lot of strength in her core and her back and stomach muscles to where the first time on the horse, she couldn't actually sit up after 10 minutes because she got so tired. And the second time her legs relaxed down without cramping, and her back, she stayed upright without falling over. And then my other gentleman, he has a brain injury, and as a result, his balance is pretty poor. His inner ear has some problems, which affects his vestibular system. So if he closes his eyes, he might fall over. And so we've done a lot of tasks on there to help that. And I actually retested him, and he's gained a lot of improvement when I retested his balance. Those are the main ones that I'm seeing right now. But again, it can be someone with Parkinson's. The rhythm of the horse actually improves somebody with Parkinson's gait. Really? So they can get that full step. You know, they typically shuffle. But after being on the horse for a while, they can take a long step, and that lasts for a while. I've had people with strokes. That's, pretty much anything, as long as there's not, a tumor in the bone or osteoporosis where they could actually get hurt. How do you, for those that might not be as mobile, how do you get them on the horse? We actually have a ramp, and so they can walk or be wheeled up in their wheelchair to the top of the ramp. The horse has about a 4 foot wide area that they walk through, maybe a little bit shorter. And my volunteers stand on the opposite side I'm on the ramp with my patient. Somebody drives the horse through to the mountain area. My volunteers are on the opposite side to make sure the person doesn't go off the other side of the horse. And then it's pretty level. The horse's back is maybe not even a foot above where the top of the ramp is. And so they can sit straight back and then pivot onto the horse from there. So
you have ways to get them on safely to be able to conduct the therapy. And is it with the adults versus the children? Or I would assume that no matter the age of the patient, there's probably apprehension depending upon their comfort level with horses.
Definitely. I think as adults, we're probably more apprehensive than a child is because we know what the risk is.
Yes.
But for the most part, especially the more balance of problems you have, the more apprehension you see. But they get better as they come, through the session.
But you must utilize techniques, I guess, to communicate with the patients to reassure them that you're going to be fine and this is going to help them.
The more anxious person, I do before we even get on the horse. Sometimes before we get on the ramp, do a step-by-step of this is what's going to happen, and then this will happen. And so they to try to put their nerves at ease. And then we get on the horse, and we sometimes, with one person in particular, we have to reiterate, this is what's going to happen next, and then do some readjustment. And then we start out very slow. I asked Jill to make sure the horse doesn't stride out too fast. I have her collect him, so he's walking at a very, very slow pace, and that lets the person adjust and get acclimated.
And then you also bring in Megan for those people that are really apprehensive and say, hey, she had never even been on a horse before.
Yes, exactly. As long as she's not dealing with a screaming child.
Now, do you ever get on the horse with the patient?
That's an old school method. To protect the horse, we try to avoid that technique. The person would have to be a very tiny little 2-year-old because we're sitting on the horse's spine. And for them to move properly and to make sure their health stays good, we don't want to break down their spine and make them sore. So we actually do not practice tandem riding, is what they call it.
And Jill McCary is with Strides, and so you must work in quite a team approach with Keely and Megan in the work that they're doing, because you're the one that knows the horses, or you're the one that is working the horses. I'm not sure what the terminology you use, but you're the one that is moving the horses around the arena.
In some cases, I am the one that I drive the horse from behind, so that allows a more natural movement.
So they're real long reins or something?
They're long reins, and I stand directly behind the horse.
Okay.
And so there's a lot of trust there.
Sure.
Got to have a horse that I trust. But that way we can get just a more normal movement from the horse, which translates to that movement with the client. And it's it's wonderful to see. It really is.
So we're painting the picture on radio for you listeners at home.
Yes.
But really it's fascinating to visualize this, that you'd be standing. It's almost like if there was a wagon there, that's the kind of the approach you'd be. If it was hitched up to a wagon, that's the range.
I would be the wagon. Yes,
Yeah.
I guess
I
would be the wagon.
But you were saying you vary the. I mean, it's depending upon the patient. The horse is moving.
Yeah, we'll vary.
Pretty slow, right?
We'll vary the pace. Keely or Megan will let me know, all right, where we need to start out at a collected walk. So that means that the horse's strides are very short. And then we may move to what we call a working walk. And that just enables a little bit more range of motion. And then possibly even an extended walk.
Okay.
And so the horses have to be willing and able to do that. Not all of the patients require that. So we do have, like I said before, wonderful volunteers who have been through training to be able to walk a horse properly.
And Shondine Schwindeman, we've talked to her in the first part of our program. Her son has been working with Jill for about 10 years now, and he has autism. And she was sharing with us the progress he's made just in his comfort level around horses. But to that level, is he on the horse just by himself now to about that, where he doesn't have to be even having Jill's assistance?
He is. Actually, at this point now, they actually trot by themselves a little bit. They go on trail rides, and she's following them around, but they go around the property a little bit and totally independent and can do everything by himself.
Okay, and now how did you, I think you touched on it, but the fact that you've seen this progress, how does that, you as a mom, make you feel to see what's happening with your son and this type of care that he's getting?
When he was diagnosed, when he was 2.5, autism was very new. And to see his progress, Jill has been with us since the beginning, since he started in the school district, and to see he's in a regular classroom. He has friends. He has his own birthday party. He wants to do all these things and try to be involved. And Strides has been an avenue to give him the confidence to do so many of those things that he probably would never have done. And to see all the little, we started with speech. We started at Cadillac with speech and occupational therapy for many, many years. And then this opportunity came up through the school district offered it for Braxton, and it's just been an amazing thing for many kids.
Well, it's well said, and I guess nobody can tell that story any better than someone who's directly impacted. We have to take one more commercial break, but we will return over the remaining minutes of Cadlick on Call talking about hippotherapy and adaptive riding using horses. Yeah, fascinating hour, and we'll be back with our final segment in just a moment.
You're listening to Cadlick on Call on 610 KONA. This program provides general information only. Any comments or information presented are strictly for educational purposes. Cadlick and 610 KONA do not endorse any of the suggestions made by the presenter or callers. Now back to Cadlick on Call. Once again, Jim Hall.
And just a few minutes left in our conversation tonight about hippotherapy and adaptive riding that's taking place out at Strides, which is located out in Mesa, where horses of all kinds are put to great use in helping patients of all ages and sizes and types of disability and just issues that they have to deal with to help them improve their quality of life. And we've had a great discussion with Keely and Megan and Jill and Sean Dean. And before we go, I do want to touch on the hippotherapy part with Megan and Keely. We talked about how you access it. You need this physical therapy evaluation. But it's also, does the insurance, is that the age-old question that people want to know? Would their health insurance cover this?
Yeah, we have quite a few insurances that we have found are covering it right now, but the ones that we have found that are not are generally Primera. Primera, one of my clients has said that they would, but you have to jump through a million hoops and get all these letters.
But in some cases, depending on just basically people
Very
need to check
few.
with their health insurance to determine if it's covered or not, right?
I always tell them to do that. So Primera, Blue Cross, and Aetna are the ones we found that don't. Group health, state insurance, they typically do. Medicare, Medicaid.
So people just should, if they obviously for those reasons want to check and see if their provider does or does not. Now, when you we touched on a lot of different parts of hippotherapy and adaptive riding tonight. One of the things that we wanted to touch on as well was you were talking about the different kinds of rhythm that the horse provides for patients, and Sean Dean's Braxton that has been making wonderful strides, pardon the pun, in his evolution as growing into a young man. But in your patients that you work with, Keely and Megan, are you seeing similar stories of what you say, and how does rhythm help these types of patients function?
So in a lot of diagnoses like autism with Braxton, the person is not able to self-organize their body because they don't have a rhythm. So the horse, we can use that movement, and we have to use that movement to attain and maintain that rhythm. And the horse's rhythm will allow the person to be able to organize and try new things.
Now, Megan, from your world, it's I love hearing your story, how you really haven't had that affinity for horses like Keely has for her whole life. But I'm guessing you just sound just as passionate about what you're doing with hippotherapy.
Yes, I love it. It's so much fun to see the joy on the kids' faces when they're out there getting to get on the horse and have fun during therapy instead of being in a clinic. So it's a totally different environment for them to explore new things. And
share maybe a story that stands out in your mind of someone who's really, that may have had that fear of horses and had challenges that otherwise they wouldn't be coming to you, and where they are today.
I have a little girl right now that is coming out to me, and she's got several different problems that makes her have difficulty walking and just function in general. She doesn't communicate. She doesn't talk. She doesn't eat a lot of foods. And so we've been doing a lot of work with her. And first on the horse, she just kind of tried to get off every time we got on. And then after a few sessions, she started to tolerate it for a little bit. And then the last couple times she was on the horse and sat there for the full 30 minutes that she was on the horse and sat upright, which she usually just kind of slumps over. So she was sitting up nice and tall with great posture. And then after her session, we were walking around the tomatoes that are out at Strides that they're growing. And she picked a tomato off the plant and put it in her mouth and ate it. And her mom was so excited, almost started crying. She was so excited that she just kind of took some food and ate it, which she doesn't typically do. So she's making great progress out there.
And Jill McCary with Strides, we've talked about the types of horses that you have in your stable, if you will, to work with patients. Talk about the horses themselves. As far as I know, it sounds like there's some pretty amazing work at just the types of horses you're working with that sometimes they're life-saving for the horses.
Yes, just recently, well, I guess in December, Keely kept Keely kept kind of bugging me with emails, not emails, texts. She kept texting me about a program that rescues horses. And so I started looking, and between the two of us, we actually settled on our first horse that we bought, and we literally bought him off the slaughter truck. His next ride was to Canada to be slaughtered. And so we bought him, and along with him came two others that we managed to bring home and sneak them in under my husband's nose. One of them is already changing lives. We generally use her almost every time that we have either hippotherapy or the adaptive riding. So it's really neat to be able to utilize a horse that was unwanted and bound for the death chamber, so to speak, and use them to change lives.
And that horse and others are definitely doing that, because we could go on for hours hearing these patient stories. It's just wonderful to hear and to learn about this type of care that's provided here in our region. Keely and Megan and Jill and Sean Dean, thank you so much for coming in and sharing your stories with us. And thank you for listening to Cadlick on Call. Again, Strides THC. You can find out more information on Facebook, or if you have that 942-2660. Thanks for listening to Cadlick on Call. See you next week.